Hello. How is everybody tonight? Thanks for coming out. It's really cold and rainy, but you made it here, and it's going to be a great evening, so I'm glad you're here. Tonight we're going to have Dr. Erika Schwartz in conversation with Adrian Lopez to talk about Dr. Erika's book, Don't Let Your Doctor Kill You, the ultimate patient playbook for navigating modern healthcare. In her book, Dr. Erika presents a plan for how to stop relying on or completely relying on your healthcare system and taking charge and being proactive about your own health. So I think that's really the point. It's not that we're going to get rid of the doctors. Dr. Erika is a founder of Evolved Science, which is a patient-centered, membership-based preventative medicine and medical aesthetics practice in New York City. Her main priority is, with her medicine and her practice, is to treat the whole person. Dr. Erika has authored 8 best-selling books. She has written articles for the New York Times, the Wall Street Journal, and Vogue, to name a few. And she also frequently appears on the Today Show and international podcasts and, of course, social media. Adrian Lopez is here to speak with Dr. Erika tonight, and she is an Emmy-nominated producer and an award winner of the National Association for Black Journalists. She's also a veteran television producer and talent executive, and in her credit is the Paul Donahue Show, as well as working with Jane London. And she was a television executive at Nickelodeon, HLN, and BET. So we've got greatness among us. After the presentation, Dr. Erika will be in the back, and Elm Street Books is in the back, so you can buy a book, and Erika will sign it for you. So with that, please help me welcome Dr. Erika and Adrian Lopez.
Good evening, everyone. Thanks so much for coming. This is a really, really great audience, and
Amazing.
welcome.
Thank you.
Good to see you, my friend.
Good to see you.
We're so excited about this this talk today, and excited to talk to my friend Erika, or Dr. Erika. I guess I should call you.
Oh, sure.
Yeah.
Next, try Dr. Schwartz.
I have to tell you something. I read this book, and I have not been able to put it down. I actually started listening to the Audible version because I just couldn't get enough. This book blew me away. There are stories in here with experiences that I know I've had in my life, or I know a friend who's had it. Erika, what is going on with the medical profession right now? Please tell us.
It's a disaster.
Yeah.
Well, you know that. Well,
Yes.
You know what? The story of this is so sad, basically, because it started in 1998 when I first wanted to write it. And my then agent said to me, "You're not known enough. Nobody knows who you are. You're going to ruin your career. You can't do this." And so I wrote 4 other books about hormones. Who knew? Anyway, and then 10 years ago, I was able to put it out.
Right.
And nothing's changed. Actually, it's gotten worse.
And this is the updated version.
This is the updated, just came out 2 weeks ago.
Yeah, but Erika, you know what? I want to talk to you about news that we had today, where you
Yes.
just got off of CBS, and News Nation and the Today Show came straight here from doing those interviews about the word on the box. Can you explain about the HRTs and the box words? Because when I started the whole menopause thing, I just looked, I was like, you've got to be kidding me. What does this all mean? If I take this drug, as you see on the TV commercials, everything's going to fall apart. So can you please tell us about that ruling that came out today, please?
Yeah. Well, what happened today is that hormones, estrogens, female hormones, had a black box warning, whether they were for perimenopause, menopause, postmenopause, it didn't really matter. they had a black box warning. And the reason they had a black box warning was outrageous, and I'll explain it to you. So it said that it would cause strokes, heart attacks, breast cancer, and osteoporosis. The truth is, none of it was true. There was a study that in 2002 was discontinued that looked at only one kind of hormone replacement therapy, which was Premarin, pregnant horse's urine, and Provera, which is a non-human identical hormone. You've heard the term bioidentical, which means hormones that look just like what our bodies make. So they were not included in the study. So that study actually was sponsored by Wyeth Pharmaceuticals and Upjohn. And the government, the US government, took $100 million from it and Upjohn and Wyeth gave the hormones, the tablets, to the academic institutions which conducted the study for free. A really clean thing to talk about. So 5.5 years into this, the results, the interim results, looked like there might be an increased risk of not cancer, but rather strokes and blood clots. The problem was that because the government knew that they were doing something not so clean, and because the academic institutions knew they were doing something not so clean, they stopped the study because they didn't want anybody to know what was going on. And the study came, the results of the study came right back at us because they took all the hormones off the market. I mean, they didn't take them off the market. They told the American College of Obstetrics and Gynecology and the North American Menopause Society and the American Endocrine Society decided that these hormones were bad, they caused problems, so they're going to tell every doctor to stop giving them. At the time, there were 7 million women on these hormones. 7 million. May not sound like a lot to you, but it sounded like a lot to me. And 7 million women were taken off these hormones overnight and left to dry up and die, basically, to get diseases, chronic diseases of aging, osteoporosis, Alzheimer's, breast cancers, all these things that actually the hormones were preventing, including these hormones that weren't so great. They were better than nothing. So what happened was that because of the fear of being outed as to what happened, they put up a black box warning. The FDA, because they were complicit in this, they put a black box warning on it saying all estrogens behave the same and they cause these problems, and you should be careful when you take them. Now, the interesting thing about it is, in 2011, which was only 8 years later, I was at the International Menopause Society, which is a pretty significant research-oriented, evidence-based, conventional medical forum. And it was in Rome, so they were talking about things, and they were saying there was no such thing as class effect. Now, what does that mean? Class effect means that every estrogen does not behave the same. Every progestogen does not behave the same. So the molecules, if they don't look alike, they're not going to behave alike in the body, which means that black box warning really did not apply to all hormones. So here comes bioidentical hormones. Bioidentical hormones were human identical natural hormones that looked identical molecularly to what your body makes when you're young. Estradiol, progesterone, testosterone, stuff that actually you can find in a medical book because you make them. When you get older and you stop making them, then you replace them. But you don't have to replace them, because the beauty of pharmaceuticals is that you can duplicate what your body makes. You can do it.
Yeah, I mean, this hits home for me because when I went to the doctor, when I started menopause, perimenopause, whatever it is, I had every symptom known to man, every one. But I was prone to blood clots. So they told me, you can't take hormones, you can't take bioidenticals, you just have to suffer. Now, I don't know about you, but I'm still in it. I'm still having, it's much better now, but I still, if someone tells you that something's going to do something bad to you, and 10 years later they say, oh, it's okay to take it now, I'm not taking it. I'm sorry. I'm just a different kind of person. I'm like, well, if it hurt people back then, it's probably,
But it didn't.
I know, but it's stuck in your head
Right.
that
And I
it
hear
was
it
going
today.
to hurt you.
Right, but I
So-
hear it even today.
Yeah.
People will come to see me. Obviously, they come to see me because they know that I've been talking about hormones since 1996, and I've been working with them, and I have patients who've been with me for 30 years. So, yeah, there is really nothing to say that the hormones, I mean, all the scientific data supported the fact that the hormones, the bioidentical hormones, were perfectly safe. But, like what you said, patients to this day will come in to me, and I do have a reputation for dealing with hormones, and they'll say, my gynecologist told me I shouldn't take it. I have a history of blood clots. My cardiologist said I shouldn't take it. My oncologist, because I had breast cancer 20 years ago, told me not to take it. So this is what I have to deal with every day, because I don't want to convince you to do anything. I just want to tell you what the truth is. And I've been around for way too long, so I know what the truth is.
Yeah, and I think that menopause affects everybody. It it definitely affects the person going through it,
And the family.
and the family, and your relationship with your partner,
work.
whoever your partner, spouse might be. Your air conditioning on in January, I mean, and all of the other things. And when I talked to my sister. My sister's older, and I said, "Did Mom ever tell you anything about menopause?" She's like, "No."
No.
I said, "Have you gotten any?" She's like, "No, I have no symptoms." I'm like, "Well, you're sweating bullets right now, and you're 65. I don't. It's
Yeah.
sort of, that's the other thing,
Sad.
is you telling the doctor, and I want to get to this too. When you go to the doctor and the doctor asks you certain questions, the regular questions, do you smoke? So you say no. Do you drink? That question seems to baffle people. It's like, do I drink? Well, yeah, I might have had a drink on the way over here. I mean, I don't know. I mean, I don't know why I feel that they asked me that question and I just lose my mind. I'm like, well, what's occasionally? Uh,
Socially.
Social. But the point I'm making is now they're telling us that drinking alcohol is going to give us all cancer.
Well,
That's the new research now.
that was in September when the Surgeon General
Right.
said that it gives you 7 types of cancer.
That's okay. What do I? Because sometimes I go to the doctor and I lie. I'll just tell you point blank. I just lie.
You're not the only one, so don't
Yeah.
feel so bad.
I think I had a drink a month ago. I don't know.
I wouldn't worry about it. Everybody lies.
Because I think that's an important thing, especially back to menopause, because the drinking, with menopause and the hot sweats and all that stuff. Can you talk a little bit
Sure.
about that, please?
So when you're young and your hormones are in balance, you can drink because your body knows how to heal itself. The body knows how to detoxify itself. Your liver is clean. You sleep for 24 hours and on a weekend and you make up for it. It works. But as you get older and your hormones leave you, which is why hormones are so crucial, then what happens is that you can't clean up anymore. And if you don't clean up anymore, you wind up with trouble. And the thing is that you live in a culture where they don't help us because during COVID, liquor stores were essential businesses. But the gym wasn't, because we were worried of each other's sweat when we never proved how COVID is transmitted.
Never. We still haven't, because
We still don't know.
it's still a question.
A huge question.
Yeah, and I think we didn't know it was like wash the mail when it comes to your house. I mean,
The
all of these
groceries.
things. Yeah, the groceries, wash everything, take your clothes. I live in an apartment building. I used to take my clothes off in the hallway because I was like afraid that something was going to get. And then I would run in and throw them in the washing machine right away, coat and everything.
Right.
We knew nothing.
Nothing. But we knew that we locked up a whole world of healthy people.
Over a year, yeah,
A whole world of healthy people.
for a long period of time.
Why?
That I wish I knew. We don't know. We still don't know about COVID,
No.
and we still don't know if that were ever to happen again, what we would do, because the things
Well,
that
hopefully
we
we
did.
wouldn't close the world.
Well, I hope that too. I do want to ask you another question. We're going to come back to menopause because I think that's on everybody's mind.
Well, the black box warning.
The black box, and that's today.
That's all I'm doing.
I want to ask you about medical care in certain neighborhoods. We know that certain people, certain hospitals in certain neighborhoods, they have certain type of care, and hospitals in other neighborhoods don't have the best care. Can you talk a little bit about that?
Sure. It's about the inequality that we live in. And to say that things have changed for the better is to lie. Because it hasn't changed for the better. I think that it's not, this is a wealthy community, and that doesn't mean you get better care. That just means you pay more for the care. That's all. You don't necessarily get better care, which is why I wrote Don't Let Your Doctor Kill You, to help everybody, whether they are wealthy, not so wealthy, poor, it doesn't matter. To me, it's not about selling books or making money. It's about leaving a legacy of information and empowerment. All I care about is helping every one of us take care of ourselves and not listen to what we're being bullied into listening. The doctor doesn't know best. I have an MD. I can guarantee you, the doctor does not know best. The doctor doesn't live in your body. So you live in your body. So the responsibility to say, makes sense or doesn't make sense, really kind of lies with you. And if you live in a poor population, in a poor community, there's so much more help you need. There's so much more support you need. And unfortunately, you don't get it. Unfortunately, you don't get it. You're ignored. But then again, women are ignored everywhere.
That's so true. And I got a note at my job today. I work for ABC, and they said you have to fill out your medical insurance thing this before December, this, that, the other. And I'm looking at the thing going like, here we go again. What choices am I going to make? When you're younger, they say you don't need to you can have a higher deductible or whatever. When you're older, things are probably going to go wrong. So can you talk a little bit about medical insurance?
Right.
Yes.
Yes. So at this point, we're eliminating any kind of medical insurance that actually will help, because it's really simple. When you're young and healthy, you shouldn't be paying for those who are old and sick, because they had an entire lifetime to stay healthy, to work on themselves, to eat better, to sleep, to take care of themselves, to exercise, to do the stuff that actually takes you to 75 healthy. You could do it. Every one of us can do it. But health insurance, ironically, and I don't understand, because I was there when they started health insurance, and I don't understand why we would think that, I have health insurance, they'll pay for it. You're paying for it. We're all paying for it. I don't know what we're thinking. Every one of us is paying for it. So when you're healthy and you're in good shape and you're taking care of yourself, all you need is really catastrophic insurance, meaning if you get run over by a bus, which could happen, you go to the emergency room and you have insurance for that. But now you can't buy catastrophic insurance anymore.
Of course not.
No, you can't. But then you think, oh, okay, I have insurance. When I go to the emergency room for a pain in my belly and they do a CAT scan on me, I'll be insured. Well, maybe they should examine you first and ask you what you ate before they do a CAT scan on you. But nobody asks. Does anybody say, why? Ask why. Why are you doing this test? What are you going to do with the results of these tests? How is that going to improve my health? How? Ask why. So with insurance, it's the same thing. We say, oh, I have insurance, they'll pay for it. And then we're so scared when we don't have insurance because we're so culturally brainwashed that we really go like, oh my God, I have to have insurance. But do we need the insurance we have?
That's the question. I have to tell you, ever since I started reading this book, I walk around with the title kind of sort of out, when I'm holding it, so that people will just be
Promoting it.
What? What do you mean that your doctor's going to kill you? What are you talking? It's a conversation piece, I have to tell you, because everybody's just like, well, that happened to me or whatever. But I want to talk about communication with your doctor when you do go in. It's sort of a part of this book is how you talk about, you start learning about the patient. Doctors spend, 60 to 90 seconds. You come in and say, oh, my toe hurt, whatever it is. They say, okay, well, I'm going to give you this. And
if they even notice
later, they don't even look at you. So that's a big thing. Is it bedside manner or
care?
Care.
How about care? So there's this guy who started out that I write about in the book, Pronovost, remember? His name is Peter Pronovost, and he was at Hopkins, and now he's at Cleveland. And he was a critical care doctor, and he found out that, first of all, to this day, medical mistakes are the number 3 cause of death in the United States. Do any of you know that?
No.
Well, maybe you should remember that was because medical errors cause more problems than all the cancers put together, the heart attacks put together, all the problems we have put together. It's medical mistakes that cause the problems. And I'm not pulling this out of my anything. It's all medical, proven. I'm a conventional doctor. I'm not making it up. And I've been doing this for a long time. So I think this guy, Pronovost, found out that if he was writing like a list of things that protocols for for a particular area of the hospital, like wash your hands, common sense, gown, cover, do common sense things to keep clean, you would have much less medical problems. The fact that he had to do that, and I'm talking about 10 years ago, it's really scary to me. But anyway, so he did a TED Talk, and he spoke about this. And he also did a research and came out that the number 1 reason medical errors exist are because of physician arrogance. So his solution was love. We should love each other. And I'm totally with it. When I wrote the original Hormone Solution, and they gave me a book tour, a book signing thing, and I got up there and I said, this is a labor of love, and all I care about is taking care of people, and I love them. And they looked at me like, is she crazy? So that's how he finished his TEDx talk. But what he said, which was so important, was the physician arrogance. Now think back in your experience with doctors, with the medical establishment, and tell me, how many of you have noticed physician arrogance? So maybe that should take the message home that you won't listen to somebody who's arrogant, to someone who doesn't care about you, someone who doesn't look you in the eye, somebody who doesn't want to know about you. How are they going to fix your toe if they don't know what kind of shoes you're wearing? How are they going to fix your eyes if they don't know what kind of light you're using? How are they going to fix your heart if they don't understand what you're eating and how much stress you're under? How could they?
That's one of the things I want to talk about too. When you talk about, diet and sleep, and you go to the doctor. You have to lose weight. You have to get some sleep. You have to drink water. You have to do all this stuff. Okay, like I know all that, but the question I have, you in your book you talk about that the United States is the most overweight country in the world, and obesity contributes to
Causes.
a lot of causes.
Obesity causes diabetes,
A lot of the
hypertension,
things, yes.
all these problems we have, cancer, all these problems, obesity. And what do we do about it? Lose some weight.
Yes, but
And by the way, go work out. And by the way, when you have no hormones and you can't move because you can't get off the couch because you're so tired, get up and go to the gym. What kind of insanity is that?
that's what I've been told. So that's what I did. I'm a good listener sometimes, and they told me to do all that, so I'm running to the gym. I'm buying every pill that comes up on my TikTok, and I have you can't come to my house because you can't get in because I have every pill that they sell on.
I'll come and clean it.
Okay, thank you. I appreciate that.
I will.
But I really want to get back to the obesity part. We have the most overweight. It is the most overweight country in the nation, and we have a pretty high cancer rate.
Yep.
And all these other
Hypertension and
things. Hypertension,
diabetes.
diabetes.
Yep.
They tell you to take all this stuff.
Mm-hmm.
You have to take it for the rest of your life. I mean, what can we do? What can we do as patients to make our visit to the doctor better?
Take responsibility and stop letting the doctor tell you what to do. Listen to what they say, but don't react. Take the message home and think it through. So, obviously, if you have no hormones, you're not going to be able to do very much. But let's say you are eating all this junk that you ate when you were 20, which was okay, and it probably was better food too.
Better junk.
Right. Better junk. But the thing is, you're not going to be able to stop it unless you get help. The GLP-1s, which are peptides, by the way, they're not drugs. I want you to hear this. They're not drugs. The FDA approved Wegovy, Mounjaro, Zepbound. They're not drugs. They're peptides. Peptides are little protein molecules that our bodies make. So don't think for a second that they are drugs. So they're pretty good. Peptides, GLP-1s, will help you lose weight. GLP-1s will put you on the right path. They work on your brain. All the data on it is coming. We've been working with them for about 6 years, but for the past 3 years, there's a lot of research on it, and the research shows us that they're really great for your brain, for your mood, for everything. Get your doctor to give you a GLP-1. Most doctors won't. They won't. They'd rather give you medication that will either treat your hypertension, your depression, which is antidepressants instead of giving you hormones, and all kinds of junk. They're not going to give you GLP-1s. But you want GLP-1s, and you want hormones.
Yeah, but I'll be skinny and flabby, right? Because don't they tell you that if you take the GLPs that you lose your muscle mass? Or
That's one way
what
to
i-
keep
what
you
is-
from it.
Okay.
You actually won't get flabby if you feel better and get over the weakness and the depression and the lack of drive that the lack of hormones and the obesity and everything else bring on. And you start working out and you feel better because when you work out, you make hormones that make you feel better. And then your skin gets tight. Shocking.
Shocking, and thank you for that.
Mm-hmm.
I appreciate it. But I want to talk a little bit about being, before we wrap up here, about being proactive
Mm-hmm.
with your doctor, with when you go into the doctor. What are some of the things that we can do to be a proactive patient?
Look at the relationship with the doctor. If the doctor doesn't notice you and thinks you're a 50-year-old or a 60-year-old or a 70-year-old or a 40-year-old, and they put you in this bucket, woman, man, whatever, and they just give you stuff, walk away. You're better off with no medical care than bad medical care. And I'm willing to bet that most of you are getting bad medical care. So you're better off with no medical care. Now, I don't know that TikTok may be the answer. I'm not sure that Instagram may be the answer. But I think at least they're giving you hope. The problem is the medical profession doesn't give you hope. So when you're going into the healthcare system and you're scared and you don't have hope, you're getting into trouble and you're better off without it. You want hope and you don't want fear. And you want to ask why. Anything they do. And you don't want to be adversarial because that's not going to work. But you want to question because it's your health. You're going to question more about a pair of boots, those gorgeous boots that you're wearing. You're going to ask more than you're going to ask about your health. So start asking about your health.
That is so true. And you know, you talk about also about educating yourself. You know, reading about stuff before you go in, reading this book, of course. But what are some of the sources that we can use to educate ourselves on, you know, when we go to the doctor? And I do want to ask you also about some of the what do you call urgent care places as well.
That was a wonderful question. Anyway, so to educate yourself, everybody goes on Google, right? Go on Google.
Dr. Google.
Go on Dr. Google. But don't believe them. The same way you shouldn't believe the conventional system or the alternative system or the functional medicine. Don't believe anybody. Just listen, read, and don't react. Then start figuring out how it feels. That's basically it. There's no big formula there. But I give you step by step how to do it.
Yes, you do.
I do. And it's because of 40 years of practicing it. I get it. I mean, I would never dare not know who my patient is before I prescribe one drop of anything. You're better off taking off the medication than putting them on medication. And then the urgy centers, let me tell you something. First of all, I want you to hear something really important. My first job out of my training was running a major trauma center, Westchester Medical Center. And I was the first woman, youngest person, cheapest person to ever run the trauma center there. But I have to tell you something. I know when somebody needs emergency care. And you will never see an emergency in your life that is a life and death emergency in this world. If it's somebody drops dead, you can't help them. If they have a heart attack, you can call 911, but you will never, ever see an emergency of that kind. So don't act like anything in your life is an emergency. Slow down, breathe, very important, breathe, and then figure out what you want to do. And that goes for cancer diagnoses, that goes for hypertension diagnoses, this goes for diabetes diagnoses, that goes for any diagnosis. Breathe, think about it. Get Dr. Google, take a look on Instagram and see what's there. Start thinking, and then find someone you trust, a friend, to be with you, to be your hearing aid, your earpiece.
What about a friend who's a doctor? I always call my friend. There's Dr. Google, and then I call my friend who's a doctor and say, "You're not going to believe what happened to me."
And
And they're like, "Adrian, calm down.
right,
Just
calm down.
calm down. What are the symptoms? Whatever." And if it's something like you think you broke your wrist or your ankle or whatever it is,
Okay.
you sort of say, he's like, "Well, if I thought that happened, I'd probably have you come in and see so and so."
And I probably would tell you to pack it in ice.
Right. And I
this-
learned that too. And
Yes.
I think when you're a mother, you
Yes.
think you're a doctor too.
You are,
Because
but you are.
you know
Adrian.
when to call 911 and when not to. If they're
Right.
turning
Well, you
colors,
are.
you might want to.
Right. But this
Make
is
a
the
phone
thing.
call.
You are the doctor. You know better than any doctor knows. Don't forget that. It'll change your life. It'll make it better. You can do it.
That's one of those things that I have twins and then I have 5 grandchildren. So every
I do
time,
too.
yeah, you have 5. Oh, good. Oh, we didn't talk about that. Okay. And every time something goes wrong, they walk up to you and say, "I have whatever, a scratch, or I have this or that." But you really know, especially with a kid, when it's something serious and when you really need.
Sure you do.
To me, I mean, I hope. I don't know if people agree.
But you do. You're not
Yeah.
missing anything.
Yeah.
You're all so afraid of missing things that you're missing your lives because you're going from doctor to doctor, from test to test, from surgery to surgery, from one idiocy to the next idiocy. And all you're doing is keeping the business going and ruining your life. Enjoy your children. Enjoy your grandchildren.
Thank you. Should I take an aspirin a day?
No. Why would you ever have taken that study? That study was on men only, and it turned out to be wrong anyway. There.
Well, Dr. Erika, my friend,
I guess I'm coming to your house next.
I think you are.
I think
because
so too.
It's a big old hot mess CVS drugstore.
Mm-hmm.
We're gonna have to wrap things up. I'm getting the
You have
wrap
questions?
up cue. I do. We are, but I wanted you to give us a couple of key takeaways. Just 2 or 3. Well,
What I didn't?
yeah. You did give us a lot of takeaways, but I'm just curious. If we have a glass of wine, are we gonna get cancer?
You're not going to
or-
die from a glass of wine.
Okay.
Just don't think that 1 glass of wine should add to 5 glasses of wine and be every day, because your body's not going to be able to handle it and you will get into trouble. So why would you want to get into trouble? The same thing with the gym. You know what? You don't have to go to the gym. There are 1,000 Instagrams that show you how to exercise.
TikToks.
Right, TikToks that show you how to exercise. Just get off the couch and do it. The same thing, make sure you sleep. I mean, it's simple.
Okay. I'm coming to see you next week because
Okay.
I'm not sleeping.
I'll take care of you.
I'm a hot mess here. So
Don't worry, I'll take care
thank
of
you.
you.
Thank you so
No,
much.
thank you so much. I have
Dr.
questions for
Erika,
these people.
you
What do
are fantastic. This is the Bible here. I'm telling you, take a look.
But it is about love.
Yes, it is about love. That's true.
And if you're not
read it.
loved by your doctor, it's not worth having.
Thank
them.
you. Thank you for that. We
Do
appreciate
you have
it.
some time to take some
We
questions?
do have time for questions. If anybody has a question, let's see here. No questions?
Come in. Wait.
Okay. We'll go first.
Exercising?
She'll go first. Oh, no, she's
Your
gonna go
exercise for the day.
Get your steps.
Hi, how are you? I have a question about supplements. Speaking of Instagram, I'm getting a lot of perimenopause supplementation sort of thing. How do you feel? What do you feel about that? Are you
I love
a-
supplements. I
Ew.
use supplements. I
Okay.
have our own line of supplements, and I use some of ours, some of others. But don't just do it because they're promoting them. It's really, there are specific supplements that work. Then there are supplements that they're promoting that may not work, and then you'll think they didn't work, but maybe they didn't contain what they were supposed to contain. So find a provider who knows about supplements and pay attention to how your body responds. And don't take 20 at once. Take one at a time and increase them over time and see what happens. I totally am pro supplements.
Thank you.
No, you have
Here, she had a question.
What is your thought around concierge medicine? You talk about your doctor knowing you, and you pay a lot of money for that. Is it worth it?
Well, I hate to say this, but I started concierge medicine. It was called membership medicine. And I'll tell you how the idea came to me. It came to me about 10 years ago because this patient came in and she had been on hormones for a couple of years, and I hadn't seen her for a whole year. And she came in and she said to me, "Your hormones don't work." And I didn't do, at the time we didn't have membership or concierge. And I said, "What do you mean they don't work?" And she said, "Well, they don't work." So, you hit the brick wall, you hit the brick wall. So I go, "Well, how long haven't they worked?" And she says, 8 months. She hadn't seen me for a year. So I'm like, oops, this is a problem. I should have known, right? So I say to her, "Well, I didn't know." And she says, "Your hormones don't work." So I went home. Clearly that she and I were not on the same page, and we moved on. But I went home and I thought and thought and thought. I said, what would make someone remember me? Because obviously you walk out of the office, I'm in the office, we're not going to remember each other. We're not going to think of each other. You go in your life, I go into my life. And there had to be a way in which you would remember me. And that's when I thought of membership. And I said, listen, if you pay a membership, you will think of me, and I will make sure that in response to this membership, I will be there for you 24 hours a day, 7 days a week. Eventually got so big that there was the whole group there, but we're there 24 hours a day, 7 days a week. Now, this thing took off. They loved it. It became concierge medicine. And when they first had their first thing, they thought we were really great, but then they forgot about us. Okay. And then the thing is that they forgot what it's about. So you have to make sure that when you join a concierge medicine practice, you're not getting freebies. It's not about the freebies. It's about the access. You want to have access to the doctors, to the nurse practitioners, to whoever is the closest person to you who will be there for you 24/7. So I'm all for concierge, but make sure it's not bullshit concierge. It's real
That's a really
concierge.
good question. I love that question.
Yeah, that was a great
Is that
question.
because it's become so popular?
Yeah, and everybody's paying for it, but nobody's getting anything for it. So that's why you want to turn around and say, what am I getting for it? And if they give you a free IV or whatever, free supplement or whatever, it's bullshit. What you want is access 24 hours a day, 7 days a week to the doctor, because that person, you can text them at whenever. I have to tell you, I have a pretty big concierge practice, and I have to tell you, nobody tortures me. When they write to me, they need me, and I respond immediately, except for right now. But I'll respond within an hour. But the thing is, it's about knowing that there's someone who cares at the other end, and that doctor knows you and has your best interest. Like this guy just ran the marathon. I just got a text from him this morning, and he's having a colonoscopy. Don't ask me why. But anyway, he's having a colonoscopy, and he wanted to know about something I was doing, and he wrote to me this morning, and I answered him, obviously. And he was so excited because I said something about peptides, because we do a lot of peptides. And I said that we'll do some new peptides when he after the colonoscopy. And he said, "Oh my God, that sounds really exciting." So that's what you want. You want real relationships. And that's what concierge should be.
We have a question from this gentleman over here.
Yeah, so I think you answered some of this question, but it sounds like our relationship with the medical industry and the medical industry is really messed up. It's dysfunctional, right? How do
That
you?
news? Is that news to you?
Yeah, a little bit, right? So because we're groomed to trust our arrogant doctors, right?
Not hopefully not anymore.
Yeah, well, I think what you're saying is, as obviously, don't do that. Ask questions, like you were saying, right? You're a good listener, and then you do what the doctor says, because the doctor's smart, right? The doctor has MD after their name. So how do we change that? The real question is, kids are trained to be like this, right? And the horses out of the barn is huge. It's a huge money maker. And the more they keep us sick, the more money the pharmaceuticals make and whatever.
They all make more money.
Right. And it's big bucks. So do you have any ideas as to how you kind of get back to the day when the doctor rode a horse and he came over to your house and he knew your name, he knew all your interests, and he healed you? That's kind of what you're talking about with a concierge.
Sure.
Practice, right, is you know my interests, you know my kids, my grandchildren, and all that.
Right.
So the question is, how do we change this, absolutely huge industry that's just going down the rails the wrong way?
One at a time. That's why I wrote the book. It's one at a time. It's about hearing the fact that culturally we are programmed, right? We're programmed to listen, to believe that the doctor knows best, to be the perfect patient. And you'll see, I think the first chapter is about being the perfect patient. And it's being the perfect patient will serve nothing but to kill you. Nothing else. So this is the thing. There's no such thing as perfect patient anymore. There's no such thing as doctor knows best anymore. There's also no such thing as Instagram knows best anymore. It's about you becoming focused on taking care of yourself and taking all this enormous amount of information that's flooding you and finding the right quarterback, the right partner for you. That's what you want. And you know what? It works. As I said to you, I have patients who've been with me for 35 years, and I'm not the only one, obviously. There's a whole crop of them coming up every day who really care. And if you don't care, just get out of here. And, when we go to the surgeon, like you have a hip surgery, right? And you say, okay, we don't care about his bedside manner because we just want the surgery done, right? You do care about the bedside manner. Because if they're not kind and caring, there's going to be complications. So it's difficult, but you can do it. And I've watched in the past 30 years so many people doing it. And I have these patients I've had for 30 years who will not go into the system anymore. They will not go. And sometimes I need them. Sometimes I need them to have surgery. Sometimes I do need a colonoscopy here and there. But they will not go in, with a blank stare saying, whatever you say is right. They will ask why first.
Thank you for that question. We have a question right over here.
Yes, hi, how are you? This is wonderful. I can't wait to get a copy of your book for myself and my mom
You're too
and
cute.
everybody I know for the holidays. Question.
This is the Christmas reading.
Yes. The question is, what are your thoughts on weight loss injections for teenagers?
That's a very good question. So interestingly enough, we have a few patients in the practice who are teenagers who the mothers brought them in. And I am of two minds. On one hand, I think that if the kid's overweight and you're talking about, the socialization of it, right, of the social aspects of it, you want to help them. On the other hand, you know that they might wind up having to take it for longer than they want to. But if it teaches them how to eat better, if it teaches them to focus more on exercise, and if it doesn't send them into eating disorders, you got a winner. So it's up to you to watch what goes on. And the ones that I have, 2 of them have been on and off GLP-1s for a couple of years, and one of them stopped after a few months and did fine. So it just becomes, I mean, I don't have anything against it, but the thing is you have to work like with everything else, and at least you know it's not medication. You're not giving them the amphetamines. You're not giving them phentermine thyroid. You're not giving them phentermine. You're giving them something that your body makes. I'm sorry, I didn't have a perfect answer for that one.
We have another question.
Sure.
Yes, could you tell me what should I do with my primary doctor who canceled my welfare exam, which was in the middle of September because of personal situation. And when I called to make another appointment, they gave me February date. And I didn't want to wait that long. So when I mentioned it to her, she said that a nurse practitioner in their office can do my, that exam. I did take that exam because I didn't want to wait until February, but I wasn't happy with it. So what should I do?
Did you tell the doctor?
Not yet.
Well, maybe you call the doctor and you tell the doctor. Maybe you stand up and say, I don't like it. And then if you think something is really important, maybe they should listen to you. Maybe they're overwhelmed and they have too many patients, or maybe they don't care. But it's up to you to decide who to stay with and whom to move on from.
See, yeah, move on. See, the thing is, I like another doctor in that practice, but I would say maybe I want to go see her for a second opinion and this, or maybe when she can't do it, I can go see the other doctor. She doesn't want to do that. She says, in our practice, we don't do that. It's just
So
one
move
doctor.
from the practice. Leave the practice. Just leave the practice.
You have to find somebody
You know what?
else, I
If
think.
the loyalty is not to you, and I understand that because I run a nice practice and my loyalty is pretty much a lot of it to the staff, the team, I mean the other doctors. But I have to tell you, if the patient's not happy, that's all that matters. You know, what was it, Sims? Sims? The customer is always right, right? Why is it in healthcare that the customer is not always right? Why? It's the only profession where instead of being all about the customer, and it's a service-oriented profession, why is it that we forget about that? And we allow them to step on us? Why?
Good question. And
Walk away.
We have time for one more question from this gentleman right here.
Wait, hold on one second so everyone can hear.
Cy and Marcy Sims, our best customers, informed consumer.
Well, we brought them.
But I'm not here to correct you.
Listen, you channeled them.
I love them, those great ads. But Dr. Schwartz, a question here. You're asking
Dr.
us.
Schwartz, oof.
Sorry, Erika.
Yes.
Dr. Eric.
Dr. Erika, excuse me. You're suggesting that knowledge is power, that we should question authority. We're living in a world where it seems like there is no authority. I always go to professionals. I'm a professional myself, not a medical doctor. And I
So what?
expect, but it's not bad, but I would expect that a professional knows more than me due to experience and training. And so that's why I confide my medical, and defer to a doctor in terms of medical issues. And then we see what's going on in Washington with RFK, et cetera, not to be political at all, but to see that there's flip-flops ongoing and more conventional research. We talked about the mini vitamins or mini aspirins. You know, it's good for you, it's bad for you, it's an anticoagulant. No, it's actually causing additional problems that outweigh the benefits. So again, a non-professional thinking about questioning the authority of a doctor who has extensive training, how can we do that intelligently rather than just be iconoclastic and saying, I don't trust you? Then I don't go to the doctor. Then I'll
Well, I
make
don't
my own
want you
decisions.
to be iconoclastic, and I don't want you to be adversarial. I'm not sending you to that. I'm sending you to thinking and knowing that what I'm saying is, yeah, I have an MD after my name, and so does everybody else you're going to see. But that doesn't mean that they know you. So you have to take the responsibility and say, this person's talking to me, and I'll tell you something else. 1 second. But this person's talking to me, right? But they don't know me. So their information may not apply to me. That's what I want you to question. Ask why. Which takes me to one very important thing that you all probably will understand, which is in the conventional medical system and the healthcare system, for those of you who know math, you know what absolute risk is. You have never gotten one piece of information in the conventional medical system about absolute risk. It's all about relative risk. Relative risk, as you know, is not exactly about what your risk is or what my risk is. So when I tell you your risk of getting ovarian cancer is 6%, I'm talking about relative risk. I'm saying 94% chance that you won't get it, and I'm not telling you what the absolute risk is. So if you think that way, and that's a little confusing, but if you think about it, then it gives you even more power to think. You don't have to be against it. You don't have to turn on them. You may not have to go back, but you have to think for yourself and say, does this make sense to me? Because I've seen way too many people who've been hurt by not asking.
That's excellent, and that's a great way to end our conversation this evening. Thank you very much. Please thank Dr. Erika Schwartz, my buddy. I'm so
Thank you.
excited we were able to do this. Thank you.
You didn't even get to half your questions.
I know, I have one more. Can we stay another couple hours? Thank you, everybody.
Thank you.
Get home safely.
Thank you. Thank you so much for coming out on this night. Thank you.